Assalamu alaikum sir, my name is Siddiqa Nawal. I am from second year 3 year. Today my presentation topic is proton pump inhibitor. First we discuss what is proton pump. An integral membrane protein in a parietal cell of stomach by using ATP and acidic hydrogen ion. They are prodrugs that active in acidic environment. Clinical use of proton pump impulse omeprazole, lansoprazole, pantoprazole, etc. Mechanism and action. The activated proton pump is converted into sulfinoid and sulfonamide converted into sulfidyl group in the proton pump and make complex, thereby irreversibly inhibiting its activity. Pharmacokinetics. The rate of proton pump inhibitor absorption is decreased by concomitant food intake. Adverse effect of proton pump inhibitor. The common adverse effect is nausea, diarrhea, abdominal pain, dizziness, etc. Medical use of proton pump inhibitor. Dyspepsia, peptic ulcer disease, gastroesophageal reflux disease. Hepatic use. Proton pump inhibitor are used principally to promote healing of gastric. In children, omeprazole is safe. In younger, omeprazole increased metabolic capacity.
Assalamu alaikum. My name is Muhammad Salman Umar, and today we're gonna talk about the GLP analog. In this, we will learn about the GLP analog and mode of action of GLP analog. And in this video, we will learn about the side effects and adverse effect of the GLP analog. Let we start from the introduction. GLP analog is a abbreviation of glucagon-like peptide receptors. It is an incretin secretory molecule. GLP-1 analog receptor antagonists are widely used in the treatment of the diabetes type 2 due to their attributes such as the body weight loss, protection of islets beta cells, promotion of islet beta cells, proliferation, and the minimal side effects. Studies have found that the GLP-1 is widely distributed on pancreatic and other tissues and has multiple biological effects such as reducing neuroinflammations, promoting nerve growth, and improving heart function, suppressing appetite, delaying gastric appetiting, and regulating the blood lipid metabolism and reducing fat deposition. In the actions of the GLP antagonist promote the first phase of the insulin secretion, reduce glucagon release, weak safety effect, and thus lowering the blood glucose with a modest weight loss without hypoglycemia. GLP-1 analog reduces the symptoms of high blood glucose levels, such as feeling thirsty. In this long-term, good control of the blood glucose level reduces the risk of the developing problems with your eyes, kidneys, and feet. Some GLP-1 analogs have also been shown to have additional benefits in protecting against heart disease and stroke. Mode of action of the GLP analog on brain, heart, GI tract, pancreas, and liver. In brain, synaptic transmission increase, nerve protection increase, memory also increases, motor function also increases. Whereas the heart, cardiovascular protection increases, heart rate increases. In liver, liver glucose production, liver fat content decreases. In pancreas, insulin synthesis increases, insulin secretion also increases, whereas blood glucose level decreases. Whereas GLP-2 analogs CNS neurons activation to trigger a pathway leading to decrease the HPG. Glucose incorporation increases, inflammation decreases, whereas in liver improvement of the hepatic function related to glucose or lipid metabolism. In treatment, use least expensive agents. Continue with the metamorphine or pioglitazone. Add SGL2 inhibitor if the postprandial hyperglycemia. Move from the lixisenatide and extend date to a glutathione if neurosis or suboptimal response. Side effects of the GLP-1 and the use of GLP-1 receptor antagonists are the gastrointestinal symptoms, mainly nausea. Other common adverse effects including injection site reaction, headache, nasopharyngitis, but these effects do not usually result in the discontinuation of the drug. Current evidence shows that the GLP-1 analog receptors antagonists had no negative effect on the cardiovascular risk of the patients. Thus, the GLP-1 receptor antagonist appears to have favorable safety profile, but ongoing trials will further assess their cardiovascular effects. And this is all about the GLP-1 analog, its mode of action, and its adverse effects. Thank you.
Albuterol drugs. Today we discuss about albuterol drugs as we know that every drugs have very different brand names according to region country. As like that albuterol drugs are mostly sold under the brand name Ventolin. It is a short acting beta 2 adrenergic receptors agonist which work by causing relaxation of airways smooth muscles. Now we discuss about its uses. Albuterol, also known as salbutamol, is used to prevent and treat wheezing and shortness of breath caused by breathing problems such as asthma, chronic obstructive pulmonary diseases. It is used to prevent asthma brought by the exercise. It is a quick relief drug. Now we discuss about its class. Albuterol belongs to a class of drugs known as bronchodilators. It works by relaxing the muscles around the airway so that they open up and you can breathe more easily. How to take Ventolin? It can be taken by following ways: by orally in a form of syrup and tablet, by inhalation, and inhalation is the most common way to take albuterol. In children 2 to 6 years, the minimum starting dose is 1 milligram as 2.5 ml 3 times daily. 6 to 12 years, the starting dose is 2 mg as 5 ml. It should be increased as we need. This is a Ventolin inhaler, and this is a inhalation solution that we cannot use as for injection. It only used to inhale. These are tablets of Ventolin, and this is a syrup is most commonly used for the children. Some there are some side effects. As we know, every drugs have its side effect as well as good effect. So its side effects are nervousness, shaking, headache, mouth and throat dryness or irritation, change in taste, cough, nausea. These side effects may be occur. And the most serious side effect, it may increase your blood pressure, decrease heart rate, may you have chest pain. And precautions: ask always ask your patient before use this medicine is he or she has any allergy, because it should be dangerous for them or some allergic reaction it can have. uh, don't give this medicine to heart patient. This drug may not use during pregnancy. It can use during pregnancy only when you have clearly need. uh, This is a short topic of albuterol drugs.
Assalamu alaikum. My name is Ishan Ahmad, student of second year group 3A. My topic is SGL2 inhibitors. What is SGL2 inhibitors? SGL2 means sodium glucose link transporter. It is a new class of drug by the use of which we will treat type 2 diabetes mellitus. SGLT glucose transporter are of two type, SGLT1, SGLT2. SGLT1 is found in intestinal mucosa of the small intestine and proximal street tubule of nephron, and SGL2 is found only in proximal convoluted tubule of nephron. Both SGLT1 and SGLT2 are responsible for the renal glucose absorption. It will absorb glucose from the renal. When glucose is going through the nephron, then it will absorb from here in PCT, mostly from PCT and PST. Approximately 90% of glucose is reabsorbed by SGLT2 in PCT, and only about 10% of glucose is reabsorbed by SGLT1 at PST. Now we discuss some SGLT2 inhibitors, some drugs. like dapagliflozin, senagliflozin, empagliflozin, ipragliflozin. Dapagliflozin is the first drug to be developed in this class, but canagliflozin is the first drug to be approved by FDA, which got the approval by 29 March 2013. Empagliflozin got the FDA approval by 1st August 2014. We can use this drug either alone or in combination with other anti-diabetic drugs, as you know, metformin, sulfonylureas, and insulin. Now we will discuss mechanism of action or mode of action of SGLT2 inhibitor. SGLT2 inhibitor inhibit inhibition of SGLT2 at PST. It prevent reabsorption of glucose, and glucose will be excreted through urine. It will appear in urine as we condition glucosuria, reduction of blood glucose level. And now we will discuss how it will affect on blood pressure. SGLT2 inhibitor cause glucosuria, and we know glucose act as osmotic diuretic, and due to which it cause dehydration, and when there will be dehydration, it cause reduction in blood pressure. And now we will discuss adverse effect of SGLT2 inhibitor. It cause infection, hypotension, and tiredness. It cause infection. SGLT2 inhibitor induce glucosuria, increase the chance of getting urinary tract infection and female genital fungal infection. And how it cause hypotension? SGLT2 inhibitors induce hypotension, can result in dizziness and fainting and a decline in renal function. And how is cause tiredness? SGLT2 inhibitor induce glucosuria, as we know, can lead to increased urination and tiredness. And now we will discuss its contraindication. It's contrary that we cannot give SGLT2 inhibitor to type 1 diabetes mellitus patient, and we cannot give it in a condition of diabetic ketoacidosis, or severe renal impairment, or end stage renal disease, or patient on dialysis, or which patient on dialysis, because it causes glucosuria. Glucose will appear in urine. That's why we cannot give SGLT2 inhibitor in these following conditions. And at the end, we discuss a possible drug interaction. When we give SGLT2 inhibitor with diuretic, it cause excessive dehydration. Because of excessive dehydration, increase risk of hypotensive reaction, and it cause dizziness, fainting, etc. Thank you so much for watching the video.
Hello, my name is Dr. Dilawani, second year, third A group. Today we are going to talk about hydrocortisone. So first of all, we talk about the history of hydrocortisone. Hydrocortisone is a synthetic form of cortisol, a hormone that is naturally produced in the adrenal gland of the body. It was first synthesized in the 1930 by a group of researchers led by Edward Kendall, who later won the Nobel Prize in Medicine for his work on hormones of the adrenal cortex. Hydrocortisone was first used medically in the 1940 to treat rheumatoid arthritis and later became a widely used medication for a variety of inflammatory conditions. And then the hydrocortisone has been extensively researched over the years, particularly for its use in treating skin conditions such as eczema and psoriasis. A study published in the Journal of the American Academy of the Dermatology found that hydrocortisone cream was effective in reducing inflammation and improving symptoms in patients with atopic dermatitis. Another study published in the Journal of Investigative Dermatology found that hydrocortisone cream was effective in reducing skin inflammation in patients with psoriasis. So now, what is hydrocortisone? Hydrocortisone is a corticosteroid hormone that is used to reduce inflammation and swelling in the body. It can be used to treat a variety of conditions including skin conditions, allergic reaction, and autoimmune disorders. So hydrocortisone is a steroid hormone that produced naturally in the body by the adrenal gland. It is also available as a medication in various forms, including creams, ointment, tablets, and injections. So let us discuss about the mechanism of action. Hydrocortisone is a corticosteroid hormone that works by binding to specific receptors in the cytoplasm of cells throughout the body, including immune cells. Once it binds to the receptor, it enters the nucleus of the cells and binds to DNA, which leads to the suppression of the transcription of inflammatory genes and the production of inflammatory proteins. Hydrocortisone is a corticosteroid hormone that works by binding to specific receptor in the cytoplasm of cell throughout the body, including immune cells. Once it binds to the receptor, it enters the nucleus of the cell and bind to DNA, which leads to the suppression of the transcription of inflammatory genes and the production of inflammatory proteins. Hydrocortisone also suppresses the activity of immune cells such as T cells and macrophages, which play a crucial role in inflammation. So let us discuss about the uses of hydrocortisone. Hydrocortisone is a medication that is used to treat various medical conditions such as skin inflammation, allergic reactions, and autoimmune disorders. It is available in different forms including creams, ointments, tablets, and injection, and can be purchased over the counter in lower concentrations or by prescription in higher strengths. Hydrocortisone is a corticosteroid hormone that works by suppressing the immune system response to inflammatory and reducing the production of inflammatory chemicals in the body. So let us discuss about the side effects of hydrocortisone, because excess of everything is bad. Like all medication, hydrocortisone can cause side effects, although not everyone experiences them. Common side effects of hydrocortisone include skin irritation, redness, itching. Long-term use or high doses of hydrocortisone can lead to more serious side effects, such as thinning of the skin, increased hair growth, acne, and changes in skin color. In rare cases, hydrocortisone can also cause more serious side effects, such as increased risk of infection, osteoporosis, and adrenal suppression. Let us discuss about the antidote in case of overdose. Hydrocortisone overdose is rare, but it can occur with long-term use of high doses of the medication. If an overdose of hydrocortisone is suspected, medical attention should be sought immediately. There is no specific antidote for hydrocortisone overdose, but treatment may involve supportive care such as managing symptoms, monitoring vital signs, and administering fluids. So, this is all about hydrocortisone, and thanks for your attention.